This is Dr. Guy Peoples, and he used to be a general surgeon at Baptist Hospital in Little Rock, Arkansas. But now, he's in Faulkner County lockup, charged with 1 count of felony. There was a bench warrant for his arrest, and the U.S. Marshals have been looking for him for the past few days. But all of that is irrelevant now because he's definitely in Faulkner County lockup. We're about to go over the court docs together of what exactly he's accused of because y'all know that I love facts, not fuckery. That being said, prepare yourself. For the sake of everyone's attention span, I'm just going to hit the highlights. However, if you would like to read this document in its totality, I will have it posted on my page for your viewing. A 70-year-old woman had just had hernia surgery at Baptist Hospital. There's a policy at Baptist Hospital where if the patient is a fall risk or needs extra care and attention, that there is a live feed in the patient's room, and there is a hospital staff member that is tasked with watching those live feeds to make sure the patient is okay. So this 70-year-old woman just had hernia surgery, and she is one of the patients that has the live feed in her room. So the virtual nurse that was in charge of watching the victim's live feed sees Dr. Peoples go into the room. She became concerned when she saw Dr. Peoples holding the patient's hand unusually close to his body and using it to touch places it shouldn't be touching. And then Dr. Peoples allegedly starts placing his hands and mouth places his hands and mouth should not be touching, including in the victim's no-no square for several minutes. She turns the volume on the monitor and she hears Dr. Peoples say, "You have to hurry up and get discharged so the real fun can start." Let me just on that one more time. Police talk with the victim that confirms all of that and then some. Side note, the victim had had hernia surgery 3 days prior, which is a type of surgery that Dr. Peoples would have done. But they also mentioned that Dr. Peoples removed bandages from her chest area. So it sounds like she had other type of medical issues going on, which makes sense to me because it's a physician that orders the live feed to be put in a patient's room, which I'm assuming Dr. Peoples didn't do. So there must have been another physician that was seeing her that put the live feed in because clearly he didn't know it was in there. Anyway, the hospital meets with Dr. Peoples and they confront him about the alleged incident. And he admitted to all of it, but said it was consensual. He has obviously since been fired and arrested. And while I'm not saying the silent things out loud about how I feel about how the hospital handled it, because surely y'all have the same questions and thoughts that I'm having about this, as you know, hospital first. I know the besties are thinking what I'm thinking, and they've just put in a request to seal the case. Really makes you trust the criminal justice system and the healthcare system, doesn't it? Thanks for choosing facts over fuckery. Make sure to like and follow for more, and I will see you guys on the next video.